Hi, everyone. My name is Ben Meiselman. I'm a postdoc at Johns Hopkins University, and during this webinar for the best viewing experience, there are some tips on the slide that you see here. If you have questions at any time about the content or about technical stuff, you can use the chat box, which is also, there's an icon that's shown on the slide right now that will connect you with the chat box. So I'm gonna now turn it over to Michelle McKeever, who is the branch chief of the National Planning and Measures branch and at the Office of Enforcement and Compliance Assurance. So Michelle, take it away.
Thanks, Ben and Paul. We're really excited to start up this evidence-based compliance assurance webinar series. And this is a collaboration between EPA's Office of Enforcement and Compliance Assurance and the Environmental Program Innovations Collaborative at Johns Hopkins University. With the new Evidence Act requirement, this is a federal congressional requirement, it's a great time for us to explore how collaboration with academics can identify effective and measurable approaches to compliance. In each of these webinars, we'll have social and behavioral scientists from top research universities, and they're going to be presenting research findings on compliance monitoring, deterrence, rule and permit design, reporting and transparency, and innovative enforcement. Today is the first of many of our great presentations that we have lined up. And coming up in the next couple of months after Dr. Ferraro's presentation will be in April, Ben Meiselman, also from Johns Hopkins, will be presenting compliance with regulatory intermediaries, evidence from lead contractors in Maryland. And then in May, we have Jody Short from UC Hastings Law presenting monitoring, a review of research on inspection and compliance for regulators. We welcome your input. So if you have ideas as you're listening to and watching these webinars, please let us know if you have ideas for future areas of research. You can respond to one of us that is on this webinar or that you received a message from announcing the webinar. So that would be me, Michelle McKeever, or David Hendon, my office director for the Office of Office of Compliance, Dr. Ferraro, or Ben Meiselman. All right, thanks, Ben.
Thanks, Michelle. So I'm going to remind everyone that if you have questions about the content or technical questions, I invite you to ask them in the group chat at any time. And without further ado, I'm going to turn it over to Professor Paul Ferraro. Paul Ferraro collaborates with scientists, lawyers, engineers, and program administrators to develop evidence-based programs to solve society's most pressing problems. His research aims to incorporate insights from the behavioral sciences into program designs and to measure program impacts on the environment and human welfare. He's a Bloomberg Distinguished Professor at Johns Hopkins University. Take it away, Paul.
Great, thanks, Ben. And welcome, everybody. It looks like we have over 130, nearly 140 people. That's great to see. Make sure my slides are now in. And today's presentation, to kick things off, I'm really happy to be the first speaker and have this opportunity, is just to talk about a simple way that program managers, by themselves or in collaboration with academics, can test their great ideas to see if they work and under what conditions do they work best. And I want to start with a non-environmental example. So charities often believe it's important to say thank you. That's something that's easily understandable, that people like to be thanked for their contributions. And about 2/3 of charities in the US personally call first-time donors to thank them for their contributions, because the charities believe that a personal thank you increases the likelihood and the amount of the second donations. The only issue is that calling is relatively expensive. Right? You only spend a minute on the call with each person to tell them thank you and why their money's going to a great cause. That can add up to a lot. You're hiring professional people who have a script, who get salaries. And when you ask charities what's the evidence that these personalized calls actually increase donations, they say their experience, decades of doing this. And then when they ask donors, do they appreciate these thank yous? Donors always say yes, they do. That makes them feel more connected to the charity. And a colleague, Anya Samek at UC San Diego, was able to convince 70 nonprofits who do these phone calls to agree to randomly select 10% of their first-time donors and not call them to say thank you. They had about 600,000 new donors in all these different nonprofits, so about 60,000 of them were selected not to get the phone call. And what they were interested in doing is comparing the donation rates from those who got the thank you versus those that didn't get the thank you. And so on this figure that you're seeing, that vertical axis is the proportion of these, measures the proportion of the second donations, right? The rate at which the people would donate a second time. And what you're seeing right now, there's 4 categories. You're only seeing one, that's the control group. That's the no call group. And among those who didn't receive a follow-up phone call to say thank you, 28% donated a second time. And those little red lines are confidence interval or margin of error. I'm just going to focus on that blue bar though for this talk. Now, what Anya did was interesting is she surveyed 200 fundraising professionals. She explained the experiment to them. She explained that 28% of the no-call group donated a second time. And she asked these fundraising professionals to predict the giving rate among first-time donors who received the thank you call. We call that a treatment group. So that's the second bar. And on average, they said that they estimated the giving rate would be 53% for the treatment group, about 25 percentage point increase in the giving rate as a result based on their experience. She also had a clever idea that University of California has a representative sample of California citizens that they do surveys with. So she added this question to one of the surveys, and 5,000 California citizens were asked to predict what did they think the giving rate would be for the group that got a personal thank you note. And they estimated almost exactly the same percentage, around 53% would be the giving rate. So a substantial increase. So I'm going to see if this is going to work. We're going to do a poll and see what you think. Launched it. Let's see if this is going to work. All right. You should be seeing in the middle of your screen a question. It's asking you, by how many percentage points does making phone calls to personally thank first-time donors increase the rate of second donation? This is an anonymous survey. No one's going to know your answer, but I'm going to encourage you all to answer. We call it the second-time donation rate is 28%, and you're being asked to estimate what you think the percentage increase in the second-time donation rates were as a result.
It seems like the poll hasn't launched yet.
That's interesting. It says attendees are now viewing questions on my end.
Oh, okay.
So,
people are saying in the chat box that they can't see it.
huh. I wonder why that is.
Nope, nobody's seeing it.
All right, well then I guess I will end it. So much for my quest to use the technology to engage people more effectively. All right, so well, I unfortunately won't be able to contrast yours, but the answer that they see is 0%. The treatment group gave exactly the same percentage, 28% roughly, as the control group. So the extra thank you had no effect. And this figure is extremely common in 2 ways. That the innovation doesn't do much better than the status quo. And the fact that blue and the red bars are very similar. and that based on experience and data and asking people, surveys and focus groups, people often have a very different expectation of what the expected effect ought to be. And these kinds of randomized controlled trials often overturn conclusions from experience or non-experimental data or studies that we might have. There's three here on the screen. One famous one is steroid injections for head injuries. It was a dominant approach in emergency rooms for decades. And the idea was that steroid injections reduce swelling. We don't want swelling inside the skull after a head injury. And based on before and after analysis, people who got the steroid injections generally survived. And finally, a couple of decades later, they ran a randomized controlled trial where at random, some patients got the injections and others didn't. And when they compared the death rates, the steroid injection recipients had higher death rates. So not only did it not work as expected, it had the opposite effect on patients, and that trial was immediately ended, and that word was sent out to hospitals all throughout the United States. For those of you who grew up in the 70s and 80s, you might remember the Scared Straight programs, where they used to take juveniles who were in trouble with the law and bring them to prison, where they got a talking to by some great characters who told them how horrible prison was. If they showed up in prison, they would be in trouble. And they found that participants were less likely to commit crimes after participating in Scared Straight. And so it was ramped up throughout the nation. And finally, after many years, some people were able to run several randomized controlled trials, all of them showing that Scared Straight didn't decrease criminal activity among juveniles, it increased criminal activity. Those who got the Scared Straight program had higher rates of criminal activity than those who didn't. And remember, both in the Thank You experiment and in these two, the groups that get the program and the groups that don't get the program, there's no difference in them on average because they're just randomly selected. A more recent example is a Camden Coalition hotspotting program to deal with super utilizers, these people that use the healthcare systems at much higher rates than other people. This was a program that was heralded in the New York Times, Washington Post. It got a huge amount of attention. It was data-driven, relationship-based, and it was alleged to have reduced costs by almost 50% among these super utilizers. It was rolled out to lots of other cities, lots of federal funding was supporting it. And to the program manager's credit, they decided they wanted to run it as an experiment to really test whether or not it reduced costs as much as they thought it did. And those results came out this year, and they found that there was no difference in utilization between program participants and non-participants. All people who were looked at as super utilizers in 1 year, if you follow them a couple of years later, they were much less likely to be using the healthcare system. So these before-after sort of evidence that we often use in the environmental arena didn't actually measure what the impacts of these programs were. The experiments did. So it was mentioned this webinar series is co-hosted by EPIC, which is based at Johns Hopkins, but it's a broader coalition of academics who collaborate with environmental practitioners at federal, state, and local levels, nonprofit as well, to do two things. One, to bring insights from the behavioral sciences like economics, sociology, psychology, neuroscience to the environmental programs, since most environmental programs are often about behavioral change. And the second pillar is what I'm talking about today, is trying to create a culture of experimentation in environmental programs. This idea of testing ideas in these pilots, where when we look at using often administrative data that we already have to see whether or not our ideas work out the way we think they're going to work out. And so EPIC tries to create these scholar practitioner collaborations. Ben's going to be talking about one of them next month. And there's other groups out there, like Chicago is going to be talking about one during the summer, where these experiments have been run in the enforcement and compliance domain. I want to give you a different example. This one's from the environmental context. I don't know how many of you get these sorts of comparisons, they're called peer comparisons or social comparisons, in the mail. comparing your energy use to your neighbors or your water's use to your neighbor's water use. Right? These are intended to get you to reduce your energy use, your water use. People have used them in recycling and other sorts of contexts. And these have been tested in tens of randomized controlled trials. And so there's a very good evidence base that these actually do reduce people's negative environmental behaviors. It gets people to reduce their energy use, their water use, all legal, what they're doing. People are paying for this, but it gets them to reduce their uses. And so we were interested in whether or not these peer comparisons could be used to target polluters, encourage them to reduce their emissions. And so we were specifically interested in the context of wastewater dischargers. So we ran a pilot in 2017 where we took 328 municipal wastewater facilities in Kansas, and we randomized them into two groups. One group received a peer comparison, comparing their compliance, and I'll explain what we meant by that, to other municipal wastewater facilities in the state. And the other half didn't receive anything at all. It just got the status quo, whatever was going on in the environment. And so we're recording this webinar. We're going to be recording all these webinars, so you can always go back and take a look at them. For those of your colleagues who you think might be interested, who haven't been able to participate live, they can watch them recorded. We'll be sending out through David and Michelle the link for where you can watch these webinars. But I just want to go over some of the key features of this intervention. So the first thing is that people are receiving, facility managers, wastewater treatment facility managers are receiving a letter. This is an actual example with the names of the wastewater treatment facility and contact person whited out. We didn't collaborate with an environmental agency. So this is coming from University of Kansas and Johns Hopkins. It explained to the people why they were receiving this letter, that based on our interviews with wastewater treatment operators, that they were not sure how their compliance performance differs from their peers. And so we're providing that information. The way in which we're communicating their behavior compared to their peers is through this discharge to limit ratio, where we compare, or we measure how much they're discharging compared to how much they're legally allowed to discharge. So if you have a 0 discharge to limit ratio, you're not discharging anything. If you have a discharge to limit ratio of 1, that means you're right at your limits. If you're above 1, you're beyond your limits. If you're below 1, you're at some fraction. So if you're at 0.5, for example, you're discharging at a point halfway to your limit. And in this context, we're focusing on biological oxygen demand. We're getting their discharge from the discharge monitoring reports, the DMRs that they send in to comply under Clean Water Act. We tell them, the lower discharge to limit ratios indicate better compliance with the facility's discharge limit. Right? So a lot of people are already complying, and we're making this sort of social norm that the closer you are to 0, the better your compliance is. Sometimes you're over complying. And then there's some more details in the letter that I'm not going to go over, but at the end they get a sense of where their compliance ratio, their discharge ratio is compared to everybody else in the state. So this particular facility is at the 13th percentile, which means that 13% of municipal facilities comply with their discharge limits to a greater extent than this facility complies, which also means we could have framed it differently and said that 87% of the other municipal facilities comply worse. The work in psychology on the use of these peer comparisons suggests that you set the norm at the most desired from an environmental perspective ratio. And then they also get this figure where they can see with that little yellow star where exactly they fall on the distribution compared to other facilities. With facilities that are in that red above 1, they're out of compliance on average. This is for 2016. So this is the year before they received the letters. They get to see how their comparison or how their performance compared with other facilities. Some of them are seeing that they're at the 99th percentile. They're way up in the red. Some of them are somewhere in the middle, but they get a sense of where they are. And the question is, do these letters change discharges at all? You could imagine it, you might find that those who are up near the top of the distribution, they're finding out they're 98th percentile, 97th percentile. They might feel the need to conform and move down that line toward better compliance. Or you might think the opposite. Those who are way down near zero might look and say, oh my God, why are we over complying so much compared to everybody else? We should change our batch time or something like that, where we don't have to incur costs to be so over compliant. Now at this point, what I would do is I would show you what we saw. So the letters were sent at the beginning of Q3 2017, and then we used the DMRs that were submitted to EPA's data portal for the next 5 quarters to measure the average discharge to limit ratio for the control group that got no letter, and then the treatment group that got a letter. For the control group, the average compliance ratio was 0.44. So on average, they're discharging at 44% of what their limit is for BOD. The reporting, that's what they're doing. And I'm going to try actually, people were seeing the poll. So I'm going to end that poll. I think people now might be able to see it. Let's see. I'm going to do this peer comparison poll. So Ben, can you see this poll?
Yes, I can.
Okay.
It seems like it's working this time. Yeah, and we got at least one confirmation in the chat.
So people are answering. And so what I'm asking you is, what do you think the treatment group's compliance ratio was compared to this control group? I'm just going to give people a minute. And again, this is an anonymous survey, anonymous poll, so you're not going to be attached. There's also an entire paper that you can find on my website, a draft paper of this entire study, if you want to take a closer look at it at some point. We've got about 76 voted, about 50%. So I think I might, and it doesn't seem like we're increasing, so I think I might just present the results. So the answers kind of vary, but almost half say it's a decrease by 10%, believing that these letters actually do get facility managers change their behavior. And the other estimates are roughly about a quarter of people think it didn't change anything. Some believe it increased the discharge ratio, and another 10% thought it decreased it by 20%. So let me share with you the actual results. Back on here. 8%, almost a 10% reduction in discharges. But the margin of error, because we only have 328 facilities, is quite large in respect to the reduction. That it's basically saying that the real effect can anywhere from just above 0 to as high as 16% reduction. So that's a pilot, and what we're hoping is Johns Hopkins University of Kansas in a week out, David Hinden, we're interested in expanding this pilot study to more states and perhaps with governments sending the letters, as well as maybe universities, and extending it beyond municipal waste water dischargers to other wastewater dischargers. But the idea was this was very simple, that we just randomly selected some facilities to be exposed to a new idea, and then used administrative data we're already collecting a year later to measure to see if there's any changes in outcomes. It's a very inexpensive intervention. If it is effective at reducing discharges by as much as 8%, that's a very cost-effective intervention. Whether it will persist over time is another question that you could follow up with administrative data and continue to look. Let me give another example from the enforcement and compliance. Most inspections in environmental agencies are unannounced or surprise inspections. You might give them 24 to 48 hours, but very infrequently do we tell them we're coming in 30, 40, 60 days, 90 days. But there are people that promote these announced or scheduled inspections. And the question is, which inspection type leads on average to greater levels of compliance over the long term? You might think that's a strange question because the unannounced inspections are sort of the status quo, and those who are in favor of them argue that if facilities know you're coming, and they're going to fix the problems right before you arrive, so telling them, you know, I'm coming in 30 days, 60 days gives no incentive to be in compliance outside of the period around the inspection. But that viewpoint assumes that facilities knowingly violate regulations, and the violations can be fixed quickly enough time. If you give them if you tip them off that you're coming, they're going to fix everything up. So like this Wall Street Journal article was sort of horrified that bank branches were told that they were getting inspections coming rather than have them be surprise inspections. But there are some academics who argue that these scheduled or announced inspections are cheaper for both the regulator and the regulated. You don't have to drive out to the facility a couple hours only to find out that no one's there, they can't do it right now, and you have to drive back and wait for another time you can do it. And for the regulator, they often find that regulators come at very inconvenient times. And the argument from these pro-announced inspection is that you're either going to see no difference in compliance, or you might even get broader and better long-term compliance by incentivizing facilities to learn the regulations and do self-audits prior to the inspection. So that idea of running around fixing the problems before you come is actually a learning experience. So that while unannounced inspection gives you strong incentives, or facilities strong incentives to fix what the inspectors find, offers weak incentives to self-audit or correct undetected violations. Right? But this viewpoint assumes that facilities are unaware of regulations or the conditions in their facilities, so that these self-audits actually are a learning experience that will lead to better compliance over the long term. Or they're assuming that the violations can't be fixed quickly, and that way, whether you tell them you're coming or not, it's not going to make much of a difference because they can't make the changes fast enough anyway. So at the beginning of 2018, 1,000 regulated facilities in multiple environmental media, so air, water, hazardous waste, were randomly split into two groups. One group was assigned to receive unannounced or surprise inspections, which is the status quo in this context. The other group was assigned to receive inspections that came with 30-day notice, or some cases, or some of the media came with even longer notices, 30, 40-day notices. That's 2018. And then next year in 2019, all 1,000 facilities were to receive a surprise inspection. So I'm going to do another poll where I'm asking you, which group had fewer violations in 2019? So remember, 2019, everybody's getting the same inspection so that the measurement is exactly the same in both groups. And we're just interested, one group the year before got the scheduled inspection and one group got the unscheduled inspection. Again, I'm going to wait till about roughly half of the responses or people respond, which should be in just a few more seconds. And I'm going to show you the results. All right, let me show the results. All right, so this one, half the people think the announced inspection group had fewer violations. Interesting, since I'm not aware of a lot of media or states where there are announced inspections. Half thought the unannounced inspection group would have fewer violations, and sorry, half 10%, and about a third thought there was no difference between the two groups. Now, I'd love to tell you what the actual results are, but we haven't run the experiment because we only had Maryland Department of the Environment interested in doing that experiment, and that wasn't enough facilities to have a small enough margin of error to be sure about what the effect is. But I really just wanted to bring it up for two reasons. One, to point out that it's not that hard to do these experiments. Right? And so this case is actually reducing the workload because some of the inspections were going to be done with scheduling, which is cheaper to do for the environmental agency. The other thing I want to point out is that because we had lots of media, every one of those groups was just offering up a small number of facilities for the experiment, so it wasn't putting an undue burden on any particular group within the environmental agency. And the third reason I bring it up is because we're looking for more states that might be interested in testing the relative effectiveness of scheduled versus unscheduled, announced versus unannounced inspections. And you can contact David or Ben or myself afterward to talk about that. We have a design that we did for Maryland and that we could apply to other states. All right, so randomized controlled trials, they make learning easier. All you're doing is taking a group of facilities that are your target population or group of humans that are being targeted, and you split them into two groups. And the key is you do it at random, not based on what you believe you know about who the worst actors are, where you'll find the violations, but at random. And then you give some one version of the program and some another version of your program, or two different programs. And then you measure the outcomes after some period of time that you think is sufficient to see the outcomes if they're going to arise. Right? We currently run thousands of experiments every year in environmental agencies throughout the US. It's just that they're uncontrolled. We do things and then we try to look at and see whether or not we think they're working, and that's very hard to do. So we're not learning as much from all this piloting, all these new ideas, trials that we do, or just switching from one program or one version to another. And so all we're promoting at EVIC is this idea that program people and academics can collaborate. The program people are doing the intervention, the academics are helping you design it and analyzing the data afterward. And it's a simple ask, test, learn, adapt framework. This is this culture of experimentation I was talking about before, where we start with what we always start with: field experience, maybe some qualitative research, surveys or focus groups. There might be some theories that we have, some other empirical studies from other contexts, but we come up with ideas. Here, I have an idea for doing something. And then the next step is what I'm arguing should be different. Instead of just kind of doing it and deciding, well, what do we think? Is it working or not? Is we run an experiment where we test the idea and we learn something about the results. In this case, we decide plan B is much better than plan A. And then we update our ideas and say, hey, maybe we should try a different version of plan B. Let's test that. Or let's try plan C versus plan B and see if we can improve it. Constantly doing this cycle of testing, not for everything we do, but for some of the things that we think are very novel and maybe they're expensive, or some things that we think really get at the crux of some of our debates that we're always having. Ben, did you have a question? No, okay. And experiments are being done in lots of places in the private sector. Amazon being an archetype where Bezos has said that's one of their main secrets of success is doing experiments. And the faster we can do them, the more we can learn, the better we're going to be, the more successful. Facebook, and if you're on Facebook, you're constantly in randomized controlled trials. You don't know it, but you're constantly being tested new ideas to see if they can increase engagement. And lots of other companies running tens of thousands of experiments out there. And it's not just the private sector. There are examples of this in federal, state, and local government agencies are running or funding experiments. Treasury, GSA, Education, Health and Human Services, Washington, D.C., where some of you might live, has a unit within the mayor's office that runs experiments trying to improve government programs. There have been experiments in the enforcement and compliance context, not many in the environmental context. This is one from OSHA that was looking to see whether or not safety inspections actually work as intended, and whether they hurt firms, as firms often say, facilities say, that they end up leading to disruptions in economic activities. There's been tons of tax compliance experiments by states and federal governments trying different ways, both warnings and fines and messaging to improve compliance with tax regulations for both businesses and for non-business entities. Police forces run experiments. And so this is Minneapolis domestic violence experiment where they randomize domestic violence offenders into arrest, advice and mediation, or an 8-hour separation from their domestic partner. These are in cases where the police officer has discretion, has probable cause to make an arrest, but has discretion, and then evaluated 6 months later with interviews and incident reports, which ones seem to be more effective at reducing recidivism. Right? So these are being done in lots of contexts where you might think, oh, how do you run an experiment in that context? And people are learning a lot in these contexts. And we'll see a couple more of these examples from the environmental enforcement and compliance in upcoming webinars. I just wanted to give some advice as I'm closing out this presentation for starting. So the first reaction I always get from environmental program people is we can't do that. We can't treat people differently. But you can. We've already gone through this with lawyers at EPA and Maryland Department of Environment. You do have the authority. You do have lots of discretion. You can treat facilities and people differently. In fact, you already do. You often have good reasons for doing it, but you already do that in lots of media. So certainly there are certain contexts where the law says you have to do an inspection every year and it has to be done this way. You might not be able to deviate from that. But we actually have a lot of scope for trying out and testing different interventions. And the only thing we're talking about here is doing it a little bit more carefully by randomly selecting some groups to be exposed to something new or different, or taking away the status quo to see whether or not things are as effective as we think they might be. In some cases, you might think, look, I can't not include people in a particular, say it's a voluntary program or it's a compliance assistance program. And you say, I can't deny certain facilities or businesses access to that. There are other creative ways of doing things. We often phase in our programs just because we don't have the bandwidth to simultaneously ramp it up across the state or across the nation. Other government agencies have done what they call random phase-in design. They say, okay, we're going to phase it in, 10% of the facilities in the first 6 months, another 10% in the next 6 months, and so on. And instead of saying, well, we're going to start in the north of the state and move south, we might often do, or near the capital and move out, we're going to just randomly pick some facilities to be the first 6 months, another group to be the next 6 months, and so on. And that gives us these random control groups over time that we can use to learn something about the effectiveness of this program. And the same thing with encouragement. Lots of voluntary programs out there that have been tested experimentally where they don't deny anybody access to the program, but they don't encourage those people to take up the programs either, but they randomly encourage some businesses or facilities to take up the program and others they don't. That's a little bit more complicated to analyze. You probably would want to partner with an academic to analyze it, but it's not that difficult to do these randomized encouragement designs. As a way to get at this question, is this program or this idea working as well as we think it is, and under what conditions, what context does it work best? Does it conform to what our prior beliefs were? Other is to start small. Mechanisms are a good place to start and to see, do we understand the context correctly? So when you think about that announced versus unannounced inspection context, it was there to test whether or not scheduled inspections could save us money without degrading compliance and maybe even encouraging or better compliance. But it was also to get this competing models we have of why do businesses, facilities fail to comply with environmental regs? Is it rational? Is it ignorance? Is it both? And it depends on different groups. Right? There's often this idea that small and medium enterprises are the ones that are ignorant. The rules are too complicated. They don't have full-time staff to deal with it. But these large enterprises, they're the ones that are rational. And they know what they're doing when they're violating. These are constant debates in the environmental enforcement community. In some ways, using these experiments not only test an idea like scheduled inspections, but also help us get some evidence on these mechanisms that we think are driving more general enforcement and compliance decisions. Generally, I advise that these should be proposed by administrators, so they're academics on the line. Generally, the experiments where academics are bringing up the ideas are not, you don't get as much buy-in from the administrators. So generally, like the scheduled inspections, that was an idea we got from Tennessee's Department of the Environment, who's interested in this idea. Do they really have to do unannounced inspections, or could they get away with scheduled inspections, which would lower their costs? So get ideas that are proposed by program people, let the academics help you tweak those ideas and help you design an intervention, and then it could be implemented by either group and then analyzed jointly together in terms of the outcomes. I don't recommend that you test whether somebody's program works or not compared to no program at all. That's basically testing whether or not someone's existence has any value. Generally, people don't like that sort of experimental design. You want to protect jobs and egos. A better test is to do a horse race, like here's version A of your program and version B, which might be the status quo, or intervention A, intervention B, and we're going to see if one's better than the other. But if they're equally effective, then we don't necessarily say, well, your program should be cut, or your budget should be cut, or you're doing a poor job. That it's there, it's just they're equally ineffective or equally effective, we don't know, but at least we've got some evidence that we don't need to switch what we're doing. I recommend you use administrative data for outcomes first. State and federal agencies, we have a lot of administrative data that are not being exploited to learn. We can do that, it's very inexpensive. In some cases, administrative data may not be sufficient. We might need to use surveys, or we might actually need observations, actual observations, maybe from remote sensing, or other data sources. Number 7 is sample size. Remember in Kansas, we had that pilot, there's 328 facilities, but our margin of error was still quite large, right? So the unscheduled versus scheduled inspections, I think we had in reality about 900 facilities. That wasn't large enough. So in some cases, we need to have multiple states collaborating together to pool their experimental data so that we can be able to more clearly detect the signal and the noise and see whether there's really a program. So in some cases, you might say, well, the entire regulated community is only 20 facilities. That's probably not going to be a good opportunity for an experiment. But in other cases, we have hundreds of facilities, and often if we combine with some other states, we can have enough observations to do an interesting experiment. And the last one, number 8 on my advice list, is the most important one. It's the biggest barrier to doing these experiments. The biggest barrier is not lack of time, lack of information or skill set, or we don't have the authority to do it. It's fear of showing that there's no effect from your idea, right? Fearing failure, that you'll be punished in a way, either psychologically punished in the sense that you have to stand up in front of your peers and say, look, my idea is no more effective than the previous stuff that we were doing, or even worse, that your budget or program gets affected by the outcome of the experiment. So what we need is administrators higher up the chain to incentivize and reward failure, right? Not just any old failure, but this kind of failure that's oriented toward learning. Right? For learning and creating evidence about what works, it's got to be rewarded, where people get the space to take a chance, and then they come back and say, that didn't work very well. that they're rewarded by saying, that's great, you developed evidence and we can tell everybody else about your experience. And if you want to run another experiment, we're on board with that. I've got that Camden hotspotting health initiative. That RCT showed that that program is not working effectively. It didn't get completely cut. It was on the program. People said, let's try something else and see if we can make this program better. And that's what you need, is where people come back and say, no, this is not working. They get rewarded to say, okay, now go try to find some more stuff that might actually work. All right.
Well, oh yeah, perfect. So I was going to let you know that we have a few questions from the chat.
Yeah,
so I'm going to start with those, and then maybe we'll open it up. So earlier on, Eleanor Ben-Ami, and also Eleanor, if you want to unmute yourself and clarify anything while Paul's giving an answer, go ahead. So Eleanor asked, can we assume that all municipal waste discharges have the same marginal impact, such that every reduction at every facility is beneficial, or are reductions at some facilities more important than others?
That's a great question. Right, so that's sort of that, what works and where does it work best? And that's one of those areas that not all facilities are the same. So it's really hard to measure the impact experimentally on a single facility. It's like taking an aspirin and trying to figure out, did it actually reduce my headache or not? Or did it just go away on its own? The best we can do are averages, but we can do subgroups. So that if you could tell us which facilities, you can group them. These are the high impact facilities and the low impact facilities. We can measure the effect of those peer comparisons within those subgroups. They might do this in medicine, where they take certain groups that they think are most at risk, and they want to know, does it really work for them? We don't care about the average for the whole population. So with more practitioner knowledge, we can ask those subgroup questions in a way that would make these results of this evidence more useful to program people.
Okay, I'm going to try something here. I'm going to give you a few questions at once so that you can just answer them as it comes to you. So Glenn, or some of them were comments, but I think maybe looking for a reaction, so you can decide what you want to go for. So Glenn wrote, I'd really want to know whether the reductions came from dischargers who were above the 50th percentile or below it, which kind of gets at the same thing Eleanor was saying. And Sean Ireland noted that the book Getting to Yes, Negotiating Agreement Without Giving In makes it clear that data alone makes very little impact toward behavior adjustment. Rather, the how the data is presented is hypercritical. And C. Dick said, it would be helpful if materials are sent to oh, sorry, that's a technical note. I'll get back to that in a minute. And regarding the announced, unannounced, yeah, go ahead.
Because I have my memory, I can handle two things. We're at the third one.
Okay.
So let me answer those two questions first. So the above the median, below, the above average, below average, we did look at that. And both groups reduced their discharges as a result of getting it. And in fact, again, it's a small sample, so there's a lot of noise. If anything, it seems like the better performers actually reduce a little bit more, which gets to that first question: are those really the people we want to affect the most? But it's both groups, both the above average and the below average. They're both reducing. So we did look at that. And then the question about how is the data presented, I imagine they're talking about the peer comparisons, but any kind of intervention, that's definitely true. And that comes again to sample size. So the bigger the group of facilities that we can experiment, the more types of ways of intervening we can test. Right? So we can test different ways of presenting the same data and seeing if that affects it, so framing it differently. So we chose one frame based on the psychology literature, because we only had the ability to do one intervention with only 328 facilities. But had we had more facilities, we could have done more ways of communicating that data. So that's very true. And that's one thing that in other experiments we test is different versions of the same information treatment. Okay, I think those were the answers for those. Go ahead.
Yeah, so I have a question. Sorry if I'm not pronouncing this correctly or parsing the name, but it's from R. McAnal. If you do get a chance to run the experiment, I think this is about the announced, unannounced one, would you consider keeping it restricted to one environmental medium to increase control or reduce variability?
So that would be the ideal. Well, so for actually measuring the effect, that would be ideal because you reduce that heterogeneity. Like I said, it'd be less noise. But there's two problems with that. That means that one environmental media, that group is taking on a lot to be able to do this experiment, and you still probably need multiple states. So we chose multiple media to reduce the burden on any one program. Every program just gave a few facilities toward this experiment, but it also helped with generalizability by having multiple media. So we might not be able to say, does it work in air, does it work in water differently versus hazardous waste, but you might get a better sense, since we do these inspections everywhere, that we find on average it works across lots of media, and that's more generalizable and more useful. So there's often this trade-off between generalizability and the ability to detect the effect well without a lot of without a big margin of error. So you want more homogeneous groups to be able to more clearly state, yeah, there's something there, but you want wider groups to be able to generalize to lots of different contexts. In the ideal case, we have both, right? We have big enough sample sizes for all of the media so that we could say something about each one individually. But in practice, we often, at least now where we are with a culture of experimentation, we don't have that luxury.
Okay, next question I have from M. Barr, which is, have you looked across states on the average discharge rate to identify variation in permit writing? Some states pushing the envelope with limits that are close to actual releases, while others make it almost impossible to have a violation. And is there a difference in water quality in these states based on whether the state pushed the envelope on permit limits?
That's a great question. So we are looking at the data now. That it's not something we looked at, so it's a great suggestion for us to take a look at. And that's the kind of, if we do multiple states, that's the kind of heterogeneity we'd be interested in. Like that, you know, what would be most interesting to program people to understand the differential effect of these that might shed some light on these other underlying mechanisms that people are interested in beyond just the particular intervention we're targeting. So we haven't looked at that, but that would be useful information. We might actually follow up with you to get more information about that as we pull the data from EPA across multiple sectors and multiple states.
Just to give you a sense of time management, I see about 5 more questions, so you can do it that way you will. And the next one is from Eleanor Ben-Ami. Can you speak to how it came to be that even though Tennessee came up with the idea of unscheduled inspections, Maryland was the only one who participated or expressed serious interest?
Yeah, well, I don't know for sure. I know that James Macy was the person who had the idea, but he was busy. And I don't know if any of his people underneath him got the message about it. So if anybody from Tennessee's on the line, maybe we can resurrect that. But we reached out and weren't able to get a response. We were at an original meeting where this was brought up and there was some excitement, but ultimately Ben Grumbles in Maryland, they said, we're interested, and Ben Meiselman, who was able to work with them to develop the experimental design and got a bunch of programs interested in it. So I don't have since I got a response, I don't know what the reason is, but I imagine it's because in some ways testing seems like a luxury, and I understand that because there's so many things on our agenda that we hope someone else develops the evidence and shares with us rather than us having to bear the cost. But it's a public good, just like all the other environmental benefits we're trying to generate, that when everybody waits for someone else to develop that evidence, we end up with no evidence.
So the next question, again, I'm going to apologize if I'm parsing the name or pronouncing it incorrectly, from Jay Ibarra is, it's a suggestion, could run a study comparing the rate of compliance against a lot of compliance assistance, hand-holding, versus issuance of a penalty order. So
Yeah. That would be a great one to do. With the U.S. Department of Agriculture, we're trying to do something similar where we're looking at financial rewards to farmers for doing certain environmental practices versus technical or compliance assistance, and the relative effectiveness and packaging them together. It'd be great to do something like that in the environmental context, because it's one of those experiments not only gets you a better sense of when does the penalizing work versus the compliance assistance, but it gets at some of that underlying argument of when are we dealing with regulated entities that just don't know what they're doing and they need that assistance, and when are we dealing with people that know what they're doing and choose not to do it, and penalties are the most effective. So Ben Meiselman, who's on the phone, he is actually working, he's not going to be presenting this, he might be presenting this next month, is working on the relative effectiveness of warnings versus fines. But compliance assistance versus fines might be equally as insightful, given how popular those interventions are. We don't really understand their relative effectiveness.
So I think that I'm going to take this opportunity to note two housekeeping things, and then I'm going to ask you questions and we'll close it out. Does that sound good, Paul? Okay, so the housekeeping thing is, since the slide is already being shown, this is information about the next webinar that's going to happen, the next webinar in this series. And the other housekeeping item is that if you want to make sure that you're receiving information about the webinar series, there's a form that you can fill out. If you've heard about it through a certain channel like a listserv, we're making efforts to continue posting about it through those same forums about future webinars, but this is a way that you'll be sure to get it done. And also there's a place on the form for suggestion or feedback if you want to give it to us about this webinar. Okay, so closing out with a couple more of the questions that I saw. CDIC asked, in studying compliance rates, were criminal prosecutions also examined, or were you looking at civil enforcement only? I'm actually not sure what that's responding to exactly.
So
that was
just to be clear, in the experiments we've designed, compliance rates are measured with violations, and they're split into major and minor. So they're not just penalties, because in fact, the idea is that we want to see fewer violations and fewer penalties. But because penalties are rare, we're looking at violations, and we separate them major and minor, because obviously some violations are more important than others.
Okay, so we've hit 1 o'clock. Do you want to keep answering questions, or should we close it out? There are two more that I see.
I mean, people can
3
drop
more.
off.
Okay.
For those of you who have a question those of you who had a question that didn't get, I'm going to put in my chat box my email address. Hold on for a second. I'm not doing it to everybody. You can send me an email if you have a question that didn't get answered that you'd like an answer for. But otherwise, go ahead, Ben.
Yeah, so I would just want to thank everyone for attending, and look forward to seeing you at future webinars, future installments of this webinar series.
All right. Thanks, everybody. Bye-bye.
Thanks, everybody.